Top 3 minerals every diabetic must take. Lower blood sugar. Hey everyone, welcome back to the channel. If you're managing diabetes, you're probably focused on cutting carbs, taking medications, or checking your blood sugar daily. But there's something huge you might be overlooking: minerals. These tiny nutrients play a massive role in keeping insulin working, protecting your nerves, and preventing complications. The problem: most diabetics are low on key minerals that directly impact their health. Today, we're diving into the top 3 minerals every diabetic needs to know about. If you're struggling with fatigue, nerve pain, or unstable blood sugar, this video could be a game changer. Stick around and let's get started. Section 1: Magnesium. First up, let's talk about magnesium. This mineral doesn't get the attention it deserves, but for diabetics, it's absolutely critical. When your blood sugar's high, your kidneys go into overdrive to flush out the excess glucose. Unfortunately, they also flush out a lot of magnesium in the process. Over time, this constant loss leaves you depleted, and low magnesium makes managing diabetes so much harder. Here's why: magnesium is like the key that helps insulin unlock your cells so glucose can get in. Without enough magnesium, your body becomes more insulin resistant, meaning blood sugar stays high, which causes even more magnesium loss. It's a vicious cycle, and most people don't even realize it's happening. So how do you know if you're low on magnesium? The signs can be subtle and often look like everyday issues. Muscle cramps, especially in your legs or feet, are a big red flag because magnesium helps muscles relax. If you're constantly tired, even after a full night's sleep, that's another clue. Magnesium is essential for producing ATP, the energy molecule your cells depend on. Nerve problems like tingling, numbness, or burning sensations in your hands and feet can also worsen with low magnesium. It's also critical for calming your nervous system, so if you're feeling anxious, struggling to sleep, or noticing irregular heartbeats, magnesium deficiency might be the culprit. These aren't just annoying symptoms. Low magnesium can damage multiple systems in your body. Let's break it down. For fertility, magnesium is a big deal. In men, low levels can reduce testosterone and weaken sperm, making conception harder. In women, it can disrupt menstrual cycles and increase pregnancy risks. Libido takes a hit too, since magnesium regulates hormones and blood flow. Your nervous system suffers without enough magnesium. Nerve pain gets worse, sensitivity increases, and repair slows down. Your kidneys are also at risk because magnesium prevents calcium buildup, and low levels make kidney stones more likely. Eye health declines too, as magnesium keeps blood vessels flexible. Without it, oxidative stress rises, increasing the risk of diabetic retinopathy, a serious complication that can lead to vision loss. Your heart and blood vessels take the biggest hit. Magnesium keeps blood pressure in check, prevents artery stiffness, and reduces inflammation. When levels drop, blood vessels tighten, blood pressure spikes, and the risk of heart attacks or strokes goes up. At the cellular level, magnesium activates insulin receptors, helping glucose enter cells. It also balances calcium inside cells to prevent stiffness, inflammation, and oxidative damage. Low magnesium leaves you feeling drained and makes insulin less effective. The good news: you can boost magnesium through food. Pumpkin seeds are a top choice. Just 1 ounce gives you about 40% of your daily needs. Cooked spinach is another powerhouse, with 1 cup providing nearly 38%. Almonds make a great snack, offering around 27% per ounce. Dark chocolate isn't just a treat, it delivers 24% of your daily magnesium in a 1 ounce serving. Avocados are also fantastic, giving you about 15% per medium fruit. These foods don't just supply magnesium, they also support blood sugar control and overall health. If you're into gourmet meals, try a Japanese miso glazed salmon with sesame spinach. It delivers over 60% of your daily magnesium while packing omega-3s for heart health. A French almond-crusted halibut with sautéed Swiss chard provides about 50% and supports insulin function. For dessert, a black truffle and dark chocolate mousse gives you over 40% of your daily magnesium while satisfying your sweet tooth. Supplements can help if food isn't enough. Magnesium glycinate is one of the best forms because it's highly absorbable and gentle on the stomach. Thorne's magnesium bisglycinate offers 200 milligrams per capsule, great for nerve function and muscle relaxation. Doctor's Best High Absorption Magnesium is another solid option, providing 200 milligrams in a chelated form for better uptake. Avoid magnesium oxide, it's poorly absorbed and can cause digestive issues. Here's the catch. Some habits drain magnesium faster. White bread, pasta, and processed grains are stripped of magnesium so they don't help. Too much sugar spikes insulin, causing your kidneys to flush out more magnesium. Caffeine, especially from energy drinks or sodas, blocks absorption. Alcohol depletes magnesium and messes with how your body uses it. Even excessive calcium from supplements can compete with magnesium, worsening deficiency. If you're feeling drained, dealing with cramps, or struggling with blood sugar, fixing magnesium levels could be a game changer. Section 2, Zinc. Next up is zinc, a mineral most people overlook, but for diabetics, it's a must. Diabetes causes you to lose zinc faster than normal. High blood sugar increases urination, and every time you pee, you're flushing out zinc. Your pancreas needs zinc to produce and release insulin properly, so low levels make blood sugar control harder. Chronic inflammation, common in diabetes, also burns through zinc as your body uses it to fight oxidative stress. Certain medications like diuretics or ACE inhibitors can further deplete zinc, making deficiency even more likely. Zinc deficiency is tricky because the signs aren't always obvious. Slow wound healing is a major clue. If cuts or scrapes take forever to heal, low zinc could be why. Frequent colds or infections are another sign, as zinc is crucial for immunity. Intense sugar cravings. That's another red flag, since zinc helps regulate insulin and appetite. Skin issues like dryness, acne, or rashes can point to low zinc, as it supports collagen and skin repair. Other signs include loss of taste or smell, white spots on nails, or hair thinning. Low zinc affects nearly every system. For fertility, it's critical. In men, low zinc reduces testosterone, lowers sperm count, and slows sperm movement, making conception harder. In women, it can cause irregular cycles and hormonal imbalances. Libido drops in both genders because zinc supports testosterone, which fuels sexual desire. Your nervous system suffers too low. Zinc worsens diabetic neuropathy, increasing tingling, burning, or pain. Kidneys are at risk, as zinc controls inflammation, and low levels increase the risk of kidney disease. Vision problems like diabetic retinopathy can worsen without enough zinc, which is vital for retinal health. Your heart is also vulnerable. Zinc keeps inflammation down, prevents artery stiffness, and regulates cholesterol. Low levels raise the risk of heart disease and strokes. At the cellular level, zinc helps insulin bind to receptors, moving glucose into cells. It's also needed to store and release insulin in the pancreas. Without enough zinc, insulin function weakens, blood sugar rises, and insulin resistance worsens. Zinc is a powerful antioxidant, fighting inflammation and oxidative stress. Low levels leave cells more damaged, aging faster, and functioning poorly. Boost zinc with food. Oysters are the best source. Just 3 medium oysters give over 200% of your daily needs. Beef liver is another powerhouse with 100 grams, providing about 80%. Pumpkin seeds offer 50% per ounce, perfect for plant-based diets. Grass-fed beef gives about 40% per 100 grams, and chickpeas provide 25% per cup. For gourmet options, try Japanese oyster sashimi with ponzu sauce. It delivers over 200% of daily zinc. French beef tartare with a quail egg yolk provides 90% in bioavailable iron. A Mediterranean grilled lamb chop with a toasted pumpkin seed crust supplies 80% and supports insulin function. Supplements like zinc picolinate or glycinate, 15-30 mg a day, are highly absorbable. Thorne's zinc picolinate or Now Foods zinc glycinate are great choices. Balance zinc with copper, as long-term use can cause copper deficiency. Avoid high-sugar diets, alcohol, and processed foods which deplete zinc. Whole grains and legumes contain phytates that block absorption, but soaking or sprouting helps. Section 3. Chromium. Last but not least is chromium, a mineral most people don't think about, but it's a game changer for diabetics. Your body loses chromium through urine, and high blood sugar makes your kidneys work harder, flushing out even more. Stress, processed carbs, and frequent urination deplete chromium faster, and since your body doesn't store much, you need a steady supply. Chromium is like insulin's helper. It's part of the glucose tolerance factor, making insulin more effective at moving sugar into cells. Without it, insulin struggles and blood sugar stays high. Chromium deficiency mimics typical diabetes symptoms, so it's easy to miss. If your blood sugar is harder to control despite no changes in your routine, low chromium could be why. Intense sugar cravings, fatigue, mental fog, or mood swings are common signs, as chromium regulates insulin appetite and brain function. Tingling or burning in your hands and feet can also point to low levels. In men, low chromium can lower testosterone and sperm quality. In women, it can cause irregular cycles and hormonal imbalances. Libido suffers as chromium supports circulation and energy. Nerves take a hit as unstable blood sugar stresses them, increasing neuropathy risk. Kidneys suffer from oxidative stress, without chromium raising the risk of damage. Vision problems like diabetic retinopathy worsen, and low chromium raises bad cholesterol, stiffens arteries, and increases heart disease risk. Boost chromium with food. Broccoli is a top source. Half a cup gives 50% of your daily needs. Grape juice provides 40% per cup, but diabetics should use it sparingly due to sugar. Brazil nuts offer 30% per nut, lean beef, 25% per 3 ounces, and eggs 10 to 15% per large egg. For gourmet meals, a Japanese Wagyu steak with sautéed broccoli and Brazil nut pesto delivers over 75% of daily chromium. A Mediterranean grilled lamb chop with rosemary-infused grape reduction provides 60%. A French duck liver pâté with poached eggs and truffle roasted mushrooms gives about 50%. Supplements like chromium, picolinate, or polynicotinate, 200-500 mg are effective. Now, Foods chromium picolinate or Thorne's version are solid options. Avoid refined sugar, processed carbs, alcohol, and excess dairy, which block absorption or increase chromium loss. There you have it, the top 3 minerals every diabetic needs: magnesium, zinc, and chromium. These nutrients are critical for insulin function, blood sugar control, and preventing complications. Most diabetics lose these minerals faster due to high blood sugar, inflammation, or medications, but you can fix it. Eat nutrient-rich foods like pumpkin seeds, oysters, and broccoli, and consider high-quality supplements if needed. Avoid sugar-processed foods, alcohol, and excess caffeine or calcium, which deplete these minerals. By addressing deficiencies, you can improve energy, reduce nerve pain, stabilize blood sugar, and lower your risk of complications. If you found this helpful, give us a like and let us know in the comments which mineral you're focusing on. Subscribe for more diabetes management tips and hit the bell so you don't miss our next video. Thanks for watching, stay healthy, and we'll see you next time.